Imagine your body as a bustling city and your blood sugar as traffic that keeps everything running. What if I told you that exercise is like a magical tool that turns your body into a well-oiled machine? In this video, we will discuss how physical activity acts as a metabolic medicine. Your insulin's best friend, natural anti-inflammatory, a fat burner, a mood booster, all in one. In our analogy of bustling city, traffic is your individual glucose molecules which have to pass through traffic light. This traffic light is controlled with insulin. That's exactly happen in the body. There is a lock and key mechanism where insulin is the key and the receptors are the lock. With time, this lock and key mechanism gets distorted. It gets rusty, it does not work. When you exercise, it is like opening side streets to divert the traffic away from main street, which require insulin or traffic lights control. Muscles soak up extra sugar and act like side exit signs, and that's how exercise improves your glucose without insulin. It improves insulin resistance. Once your roads are not bustling with extra sugar, your key and lock mechanism start working properly, your insulin resistance goes down and you start getting better, you start losing weight. And if in addition to aerobic exercise, you start doing resistance exercise which increases muscle mass, this means you have more exit signs. Exercise is the best destroyer of visceral fat. There is a difference between visceral fat and subcutaneous fat. Visceral fat is deposited in your intestine, pancreas, liver, and it is very vascular because these organs are very vascular. Above all, this visceral fat responds to hormones differently. Because of increased blood supply, this visceral fat is metabolically very active. This is where all the chemicals of inflammation, insulin resistance are produced. If you start exercising, you start consuming visceral fat, then total visceral fat decreases and the net effect is decreased inflammation, improved insulin sensitivity, weight loss, and all the inflammation will disappear from your body. Exercise work through hormones which include increased level of hormone adiponectin. This is the one which makes insulin work better and use fat. It reduces insulin resistance. Exercise decreases cortisol level. That's how it leads to less stress and weight loss. It improves the function of leptin like insulin. Leptin resistance is very common in obese people. Leptin is needed to let your brain know that there is enough energy reserve in your body. When you are obese, you're carrying extra pounds, you develop leptin resistance. Exercise is a lifestyle upgrade. Simple ways to get started. Key is to stay consistent. Finding activities you enjoy and setting up realistic smart goals. Do not go by what your emotions are telling you today. Be hyper realistic. Make small changes but make it forever. Exercise is your transformative journey. I have been inspired by my son who lost more than 100 pounds with diet, exercise, sleeping better, and managing his stress. He is a thriving young man in fourth year of medical school and doing well. He has not forgotten his journey, rather he has made it. I believe exercise is your best ally in a fight against diabetes. If you walk 30 minutes a day, you can lower your hemoglobin A1C from 0.5 to 1%. If you walk at a speed of 4 kilometers per hour, you lower the risk of diabetes. I believe if somebody start moving, they can reverse diabetes, pre-diabetes, they could boost their metabolism, decrease inflammation, and they will have a long, happy life. I hope this video was helpful and educational. I've created a long series of different aspects of diabetes, with prevention being the focus and treatment being the cornerstone. Like, share, and subscribe to our channel Kunlas MD. Thank you.